Ryles tube insertion. First is uses. It is used for gastric lavage, in organophosphorus poisoning and drug overdoses. It is used to give feeding to unconscious and uncooperative patients. Drugs can also be given through Ryles tube in unconscious and uncooperative patients. And it is used for Ryles tube suction in cases of acute abdomen like acute cholecystitis, acute appendicitis, pancreatitis, intestinal obstruction, then Hitchcock disease and interceptions. Then we have contraindications. Contraindications are alkali and acid poisoning, gastroesophageal reflux disease, stricture in the nostrils, ulcer in the nostril, then fracture base of neck. These are the contraindications. Ryles tube is made up of PVC or silicone. Now procedure. At first we have to explain the procedure to the patient, and in case of unconscious patient to the patient parties. Then we have to take consent. For inserting the Ryles tube, we have to keep the head of the patient in semi-upright position. Then under all aseptic measure, we take out the Ryles tube from the pack and we lubricate its tip with the 2% xylocaine jelly, and then we ask the patient to swallow the tube. Then we insert the tube through the nostril and ask the patient to swallow the tube. Then this process is continued until the Ryles tube is inserted up to the desired mark. Now what is the desired mark? We take the length, we measure the length of the Ryles tube which is required to be inserted. The measurement is from ala of nose to angle of mandible, and from angle of mandible to the sternum, manubriae, and then we mark it and we insert the Ryles tube up to that mark only. Now how to check the Ryles tube whether it is in position? There are two methods, clinical method and radiological method. In clinical method, we place the stethoscope in the epigastrium of the patient and pass some air into the Ryles tube, and we can hear bubbling sound. And we can also do suction with 50 cc syringe where we can see gastric contents coming out. And the radiological method is X-ray. The tip of the Ryles tube contains radiopaque material which produces radiopaque shadows, and the tip contains small openings through which the contents are either suctioned or given in the stomach or duodenum.